We shall now discuss the topic Alzheimer's disease for PG medical entrance examinations. I am Dr. Nandanavanam, MBBS MD Pharmacology. So first thing, what do you need to know about Alzheimer's disease regarding PG entrance examinations? This is a very short topic. Usually you will get very less number of questions in this topic. Firstly, we should know about the biomarkers in the Alzheimer's disease, which are used for the diagnosis of the Alzheimer's disease. What are the biomarkers? Fluid biomarkers, which we can see in CSF and plasma. We can see any changes in A beta and tau amyloid proteins, and imaging biomarkers. When done on my MRI scan, we can see these biomarkers which we give as a dye: fluorobutapir and fluorobutaben and flutemetamol and fluortazpir. The cause of death in Alzheimer's disease is generally the complications of immobility, pneumonia, and pulmonary embolism. Clinical summary: early stage, we use cholinesterase inhibitors. When the disease is in early stage but with positive amyloid, we can use aducanumab and lecanemab injections. Lecanemab is a recent advance. Further stages, when the disease progresses further, we can add memantine. Those are effective in mild to moderate dementia. These galantamine tablets, donepezil, and this rivastigmine transdermal system. We can expect a MCQ. Rivastigmine is the thing, is a drug which is given through transdermal route. They are effective in mild to moderate dementia. Effect is modest but not dramatic. They delays clinical deterioration for 6 to 12 months. Side effects of these agents are GI distress, muscle cramping, and abnormal dreams. Precautions to be used with caution in bradycardia and syncope. Uncompetitive antagonists of NMDA type glutamate receptor. This is a memantine. As I told you earlier, this is used in advanced cases. It blocks pathological NMDA receptor, which leads to prevent excitotoxicity. Permits physiological activation of NMDA receptor, leading to promote learning and memory. It is effective in moderate to severe dementia. Anti-A beta antibodies, amyloid antibodies, is this aducanumab. This is an amyloid immunotherapy. It reduces amyloid plaques. It is effective in mild dementia stage because amyloid deposits begin 15 years before the onset of the symptoms. Side effects of these is ARAS, amyloid-related imaging abnormalities. These are characterized by localized cerebral edema and microhemorrhages seen on MRI. Mostly these cases are asymptomatic and these are reversible. May cause clinically headache, dizziness, nausea. Treatment to behavioral symptoms. BPSD, behavioral and psychiatric symptoms in dementia. We use this citalopram and SSRI for agitations. These coming to benzodiazepines, they control acute agitation, but benzodiazepines are not recommended for long-term management because these benzodiazepines worsen cognition on further days. This is one thing. Pyretinol. This selectively increases glucose transport across blood-brain barrier. It improves regional blood flow in ischemic brain areas. This codargocrin is another drug. It selectively increases cerebral blood flow. This pyridine is a dopaminergic agonist. Citicoline is this increases blood flow to the brain. What we can expect in MCQ is just these one-liners. And ginkgo biloba is one thing which we can find in as a health supplement. Actually this is a dried extract of a Chinese plant. This drug is having a risk of bleeding. Additional drugs in Alzheimer's are vitamin E capsules used in some higher doses and acetyl L-carnitine. Coming to few MCQs, all are cerebrospinal anticholinesterase used in Alzheimer's disease except galantamine, donepezil, rivastigmine. We have seen in earlier slide, but the answer will be pyridostigmine. Why not pyridostigmine? Because it is tertiary amine. All these three are tertiary amine compounds. This is quaternary amine compounds. Sorry, pyridostigmine is quaternary amine compound. All of the following drugs are used presently for the treatment of Alzheimer's disease except Tacrine, galantamine, donepezil, rivastigmine. The answer is tacrine because tacrine is banned nowadays. Previously it is used. Come one more assertion and reason. Beta blockers can be used in acute agitation in Alzheimer's disease. Beta blockers cannot be used for long-term therapy in Alzheimer's disease because they worsen cognition further. And the answer is both are false because these things for acute agitation we said benzodiazepines, not beta blockers. Learn what to learn with respect to PG entrance examinations and follow my Telegram channel to know more updates.